Hello, my name is Jeff Charlton. I'm the author and presenter of this module. I hope you find it of use and of interest, and if you do, please have a look at the courses on our 9919.org website. We also provide site, telephone and web-enabled consultancy services. Thank you. This pandemic awareness module is written to provide the employer and facility or building manager with practical risk management solutions. The ideas and content have been derived from 25 years of working worldwide in disaster recovery, including biological and chemical contaminants, where I have personally been responsible for the safety of my clients and up to 400 employees. I'm not going to mince words. You don't need selling, you need solutions. If you haven't already seen our module on personal protection, you should, because it provides important information about how you can protect people before they come into your building, and also reduces their potential exposure to pathogens or pandemic on their way to work or home. In this module, we look at emerging and current health threats and risks. Why should we look at these risks in different ways to conventional risks? We discuss the options you have in utilising your employees to provide maximum benefit and identify ways to reduce their exposure to hazards and reduce risk generally. We discuss possible disruptions generally and ways to minimise these effects. We identify cross-contamination issues within the building or workplace and specifically how pathogens are spread together with control measures. We discuss methods of sanitation and how to reduce the risk to building occupants or employees. Misconceptions about sanitation and hygiene are reviewed and personal protection discussed. The fact that all healthcare workers were infected in the 2003 SARS outbreak is probably the worst information you might want to hear, because you may wrongly believe there is no protection that will work. You can see the full report on the reasons for this from the link shown on the bottom of the screen by going to safetyhood.com and the download section. This news is devastating with regard to protecting employees, but we should learn and benefit from it. The reality is that the healthcare professionals unfortunately followed internationally recognised historic procedures which can now be seen to be flawed. The major problems arose because the healthcare professionals were not trained to fit, wear or take off the protection. Secondly, and most importantly, the masks which were worn did not cover or protect the eyes, which is now a known route of infection. These factors and solutions are explained in greater detail in our personal protection module, which shows fit and use application of hoods or full face respirators. We have discussed fomites and the ability of a virus or bacteria to live on inanimate objects for up to 48 hours. This could mean that a person carrying the infection could deposit on any surface from sneeze, cough or hand. It makes good sense to remove this contamination through a good sanitising program to prevent others picking it up, known as cross-infection. Let's make no mistake, the best method of sanitation is cleaning. But as can be seen in our example of hospital infection control, this isn't as easy as it may first appear. First of all, we need cleaners that will clean every square inch. Continuously clean or rinse or replace the cleaning cloth to prevent it from becoming a fomite. We have seen just how difficult it is to sanitise a hospital to remove MRSA and general nosocomial hospital infections. Do you really think overnight cleaners can achieve in a few hours what trained infection control people in a hospital setting can't? The next important issue is just how effective is the proposed sanitising agent. You can see from the slide that all sanitants have limitations and you may be wasting your money on any but focused hygiene programs. I say focused because this is the best as you can monitor. There are tests to assess if your cleaning regime is working based on ultraviolet light and trace substances. The sanitising agent choice is most important, as it can be seen from the chart. Some can be irritants or corrosive. This chart also shows the efficacy or efficiency of the sanitising agents and how some simply are no use or easily destroyed. This slide shows a typical application for outbreak control or sanitation maintenance in times of pandemic or epidemic. You should note that different formulations can be used in both hot or cold application, and that sanitising agents and application must be paired to the problem or situation. No effective large-scale sanitising bacteria or virus killing agent should be used in the presence of anyone that isn't suitably protected. The choice of sanitant should depend on the target organism, time frame and safety issues. Obviously, cost is a major consideration next to safety. So we can see that practical defence revolves around the realisation and acceptance of threat and vulnerability, followed by education to our supply chain, employees and perhaps their families, with specific focus on key employees. Training should be followed with role play and or desktop exercise. Personal protective equipment or PPE is an absolute essential factor when considering travel to and from work or in high-risk situations. Engineering controls in the workplace are also essential to ensure that you are in control of your working environment and that you do not rely on some remote operation or person for your safety. Of course, the final message must be that medicine or prophylactic care is unlikely to help us in the emerging disease to which we have no immunity or are drug resistant.